Hi, I'm Dr. Carrie K, and I am a plastic surgeon at the University of Texas MD Anderson Cancer Center in Houston, Texas, where I specialize in breast reconstruction in women who have experienced breast cancer. 1 in 8 women in the United States will experience breast cancer at some point in her lifetime, and many of these women will undergo reconstructive surgery in order to restore and rebuild the breast as part of their breast cancer treatment. Now, the journey of breast reconstruction can have speed bumps along the way. Complications can happen, such as infections and poor healing. So much of the research that has been done in breast reconstruction over the past few decades has focused on how to avoid these complications. For example, we have looked at how to pick the best operations for each patient, how to better do these operations, and also how to keep our patients as healthy as possible around the time of surgery, for instance, by avoiding smoking around the time of reconstruction. But while we know a lot already about the physical things that doctors and patients can do to try to minimize having problems after surgery, what about what's in the mind of the patient who has breast cancer? How does the link between what's in her mind, her beliefs, her attitudes, her thoughts, her feelings, how do these affect her physical health? Does the way that a woman views herself or her body have any impact on the actual physical outcomes after breast reconstruction surgery? I'm really excited about this paper by Dr. Losken and his colleagues from Emory University because they have taken a completely fresh and new point of view, the patient's psychologic point of view, even before any surgery has actually happened, and drawn a possible link from that to the likelihood of physical complications after breast reconstruction surgery. Before their surgeries, 302 women answered standardized questions about body image using a very popular survey tool called the Breast Q. And then they went on to have their breast reconstruction surgeries. So of the patients who responded, the women who said they were less satisfied before surgery with the way they looked unclothed in front of a mirror, or the women who reported being less self-confident or less attractive, were more likely after surgery to have infections. What's more, the women who said that they were less satisfied with how bras fit them and also were less satisfied with how they looked in front of a mirror were also more likely to experience wound healing problems after surgery. Now, this idea that a more negative body image before surgery can be linked to complications after breast reconstruction is something that's never been explored before. Now, of course, there are a lot of reasons that can explain these findings, and we can't say based on the study that the patient's thoughts are causing the complications per se. There may be other related issues that affect these relationships like body weight, breast size, additional cancer treatments, or maybe psychological illnesses that are not fully accounted for in the study. But what I take from the study is the importance of finding out more from women about their state of mind and how they view themselves and their bodies, even as they're just starting to think about setting on the journey of breast reconstruction. Because I think if we know about all the things that put a woman at risk for complications after surgery, including her state of mind beforehand, there may be an opportunity to better support her, to counsel her, to prepare her for the changes to come, and maybe even then reduce her risk of actually developing complications after reconstructive surgery. I think being diagnosed with breast cancer is stressful and anxiety-provoking in and of itself. We are finally starting to learn more about how the mind can be linked with the body in ways that we really didn't recognize before. The study represents an exciting new direction in making breast reconstruction surgery safer and more successful for women in a very patient-focused kind of way.